Hey everybody, it's Dr. Broom here at Broom Chiropractic and Sports Therapy, and I've got a new exercise video to demo today. And this one's more of an advanced stretch, if you want to say. Really, I like to say that it's a version of controlled mobility work. So you may feel some muscle stretching as you go about the movement, but it's not necessarily the intention. So today's movement is called a cervical CAR, and the CAR is an acronym. It stands for Controlled Articular Rotation. Articular is just referring to the joint spaces, and we're doing a cervical, which is for the neck. So essentially the neck joints, we're bringing them through a controlled rotation. So that's the acronym. And a couple things need to be said at the outset with this one. One is you need to do it slow. The faster that you do it, the less you're going to reap out of the exercise or out of the stretch itself. And then next is you should feel like you were in control the whole time. And so if something is painful, you can back out of it and go the other direction, or just do less of the range of motion. And I'll demonstrate that as I do it here in a second. It'll make a little more sense. But your setup, you can do it seated, you can do it standing. You need to tense up the rest of your body to isolate just to the neck moving. So if I'm sitting down, I'm going to make fist. I'm going to bring my shoulder blades down, and I'm going to kind of tense up core, get a good brace, tense my arms a little bit, kind of pull them into my side, make sure my feet are firmly pushing in the ground to make sure everything's tense here. And then the first movement that you do with the neck is I'm going to give myself a little bit of a chin tuck. And then I'm going to slowly roll my head down into flexion. So you see how I move pretty slow there. I tried to very incrementally move my first vertebrae, second vertebrae, third, fourth, is that type of intention that you want when doing this exercise. And I'm going to max out how much flexion I can do with my neck. Once I max out, I'm either going to go to the left or to the right, and I'm going to almost sweep my chin across my collarbone here until I get as far as I can with flexion and with rotation to one side. So what that would look like is I'm already in flexion. And I get to there. So I've now maxed out to that corner, flexion and rotation. And then once I'm there, I'll bring my head back into that almost kind of a lateral bend of the neck with the rotation. And then I'll work my way backwards into extension. And you can see how I kind of progressively move my head back around into just extension, and then extension on the other side, rotation, and then back all the way down to flexion. So that is the full maneuver all the way through a cervical CAR. So like I said again from the beginning, the whole time you should be in control. If at any one point, for example, you get back here in that motion, you're like, that's kind of sharp. That's a little bit pinching in the neck right there. Well, then just back off a little bit. Don't go that far, or don't pull into it that much. Or you can get to that point and then reverse and go back the other way. But you would want to do a full circle one way and then reverse it, do a full circle the other way. And what I was doing it there, I was trying to demo it slow enough to where you could see, but fast enough the way this isn't a boring video. But really, one full circle should take you almost maybe a minute long. Like it should be very, very slow. You're very intentional about moving your neck, all of your neck joints through their very most end ranges of motion for all of the ranges of motion of the neck. So that is the cervical CAR. the car principle applied to the neck. Give that a try. It should be a very healthy maneuver for the neck joints to move them through as a daily movement snack, if you will. So be sure, like, subscribe, follow for more videos coming soon. But hopefully this is helpful for your neck mobility. Thank you.